Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D. Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D. Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved one plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, and everybody you know to listen to the show, available on podcast and music apps worldwide. If you have a question or an idea for a future program, share your idea with me by commenting on my social media posts on Facebook, Twitter, YouTube, and LinkedIn. You can also go to my website. It's PamelaDWilson.com. Click on the Contact Me button and complete the caregiver survey. Welcome to the Caring Generation and this week's episode, number 177. Caregivers, if you don't have a caregiving plan, you won't have a life. While this may seem like a very strong statement to make, caregivers who have been in this role for some time will attest that caregiving, responsibilities, and related emotional stressors can become all-consuming. This topic is also very relevant for caregivers who are young and healthy, and who may not have a care plan for themselves in their retirement years. Everything learned from caring for an aging parent or a spouse is a lesson in preparing to care for yourself. Add to this factors like the cost of hiring in-home care, accessing and paying for health insurance or medical care, and paying for assisted living or nursing home rates. Medicare does not generally pay for this type of care unless there is a medical necessity. The price paid by family caregivers of aging parents or spouses can drain bank accounts, ruin health, and damage family relationships. If you're new to being a caregiver or new along the way in the journey, know that being a caregiver can extend much longer than you think. Stay with me while I discuss 3 areas. 1, why it's important to have a caregiving plan so that caregiving doesn't take over your life and your bank account. 2, I'll offer practical steps about creating a medical and a financial care plan. And 3, we'll discuss things you never thought you would have to do as a caregiver and how to learn or gain these skills. The caregiving journey, it's different for everybody, as are the circumstances. There may be no perfect answers because of the people involved, unexpected circumstances, and other factors that make your situation different from everybody else's. Know that the choices in front of you may not be perfect, meaning that you feel that none of them are good, but still, you have to choose. We're here to celebrate the diversity of ideas, the pros and cons of thinking one way or another, and to realize the importance of not placing oneself in a situation of routine, feeling hopeless, or barely getting by. Let's begin by discussing the price paid by family caregivers who don't have a caregiving plan. I call this sticker shock. I pulled costs from the Genworth Cost of Care calculator, and I have the information for 4 states. Colorado, because this is where I live, and care here is expensive compared to other places. Then 2 coastal states, California and New York, and then Texas on the southern border of the United States. These numbers are for 2021. So in 2021, the average annual cost for a private assisted living 1-bedroom unit in Colorado was $57,500 a year. California, $63,000. New York, $54,950. And Texas, $47,940. Now, I'll tell you that these rates have probably already risen anywhere from 6 to 12% if you're thinking about what the rates would be in 2023 or 24 or 25. Let's look at nursing home rates. A shared, not a private room, but a shared nursing home room in Colorado in 2021, $102,810. California, $117,530. New York, $153,500. And Texas, $61,503. Hearing these numbers, you may think that, maybe Texas is a pretty good place to live and take care of my parents. Well, it always depends, right? So similar to the nursing home costs and the assisted living costs, again, the rates that I said today are going to be 6 to 12% higher in 2023, 2024, 2025. The question is, how many of you have parents with $50,000 or $100,000 or $200,000 or more sitting in the bank? If you do, you're very lucky. Of all the 4 states that I shared, Colorado, California, New York, and Texas, Texas currently has the lowest cost for assisted living and nursing homes, but again, this could change at any time. One reason to create a caregiving plan is to have a financial plan for the care of elderly parents so that you know whether your parents can afford care in different types of areas. So an assisted living community, a nursing home, home care. And while you're thinking about this plan, I always suggest to create a plan for yourself, you and your spouse, you and your partner, you by yourself, because it's important to consider the amount of money you will have to spend if you don't purchase a long-term care insurance policy to be able to pay for your care when you're older. Now, along the lines of this financial care plan, depending on your relationship with your parents, they may or may not be comfortable sharing information about their bank accounts and financial situation, their savings, their monthly income, their investments. If that's the case, it's important for you to help them understand why these discussions are important. And if they don't want to have the discussions with you, suggest that they have them with someone, whether it's their CPA, an attorney, somebody else, whoever they trust, because not having these discussions is what causes the high price for family caregivers of burnout and exhaustion and frustration and giving up jobs and actually ruining your retirement years, because you will be giving away your time and your money today to care for your aging parents. So creating this financial plan can be difficult if you don't have all the facts, some of which I just mentioned about the high costs of care associated with assisted living and nursing homes. While none of us think that we are ever going to need care, or at least we hope we won't, this is going to happen to everybody, to varying degrees if we live long enough. There's so many things that we don't think about until later, when health does become a concern, because these things may not seem health related, but they definitely put stress on our lives. You might have heard me talk about something, this is a healthcare term, called social determinants of health. These are factors, and I'll give some examples. Children having a stable upbringing with access to schools, parental support, having a safe home, clothing, and access to food. For young and middle-aged adults, these social determinants of health factors can also be things like education. But it can also be, do you have a job? Can you afford your rent? Transportation to work? Do you have a car? Can you afford to maintain the car? Can you afford to buy groceries? And then we go over to relationships in the workplace and family life. Any one of these factors that is not truly or directly medically related can cause a lot of physical and emotional stress that does then impact your health and your well-being. Now, at first, these effects may not even be noticeable, but they stack up over time. Did you know that there are factors that result in a diagnosis of Alzheimer's or dementia beginning 20 to 30 years before a diagnosis? If we look back, if we have that ability to do so, many things in life we realize have a timeline of a cause and an effect, which is why this discussion of if you don't have a caregiving plan, you won't have a life is so important, because not having a plan does lead to the effect of not having a life and being a burned out and highly stressed caregiver. So let's talk a little bit about timelines. In continuing to consider the price caregivers pay and care costs, let's look at family life. If you're married and have children, you are caregivers for your children. The timeline of caregiving goes something like this. You have children, then you're caring for aging parents, then maybe a spouse if you're married or partnered. And then eventually, after that timeline advances to caring for a spouse or a partner, you may be in the middle. So in the middle of all this, you may be a person who needs care as that caregiver, or maybe you're pretty healthy and the timeline of needing care is well after you have taken care of everybody else. Traditionally, women have been the caregivers who give up their jobs and their income to raise children. Then they go on to care for elderly parents or a spouse, and they never seem to get back into the workforce. While more men are definitely becoming involved in caregiving, they rarely give up their jobs. The price paid by caregivers primarily relates to women who give up earnings, income, retirement savings to be caregivers for children and aging parents and spouses. These women rarely, if ever, have the opportunity to make up for lost years and lost income due to being out of the workforce. They are unable to make up on retirement savings. And then let's add to this the other costs that we discussed that relate to physical and mental health problems. A lot of caregivers will place their healthcare needs at the bottom of the pile because they're too busy to take care of themselves, because they're doing and doing and doing for everybody else. Placing caregiving needs last means that caregivers are more than likely the next people in line who will need care. Here's another example of a caregiver timeline. If you're an adult child and you're a caregiver, maybe you're married with children or even single, look at your daily activities. What parts of life do you trade to have, to care for, or to raise children? On the other hand, what parts of your life do you trade to care for elderly parents? Every choice and every decision has short and long-term consequences. If you have children, you know you're committed for 18 to 20 years before they hopefully go off, live independently, and never come back home. The situation with the care of aging parents is similar, but it's opposite. If you have aging parents, you may be committed for that same period of time, 18 to 20 years. The difference is that you support a life in decline instead of a life of possibility. While some caregiving skills may be similar, like empathy and compassion, running a household, some of the skills required to care for aging parents are different. This is a perfect opportunity for us to take a short break. I'm Pamela D. Wilson. You're with me on The Caring Generation, episode 177. If you don't have a caregiving plan, you won't have a life. Visit my website, PamelaDWilson.com, for more help and support. Also, check out my YouTube channel, at Pamela D. Wilson, Caregiving Expert. There are over 800 videos answering questions caregivers ask. You can also search by topic on my YouTube channel. And know that if you have suggestions for videos on my YouTube channel, you go to my website, PamelaDWilson.com, click on the Contact Me button, fill out that caregiver survey, and send me a message. Stay with me. We'll be right back. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. We're back with episode 177 of the Caring Generation podcast. If you don't have a caregiving plan, you won't have a life. For detailed information about making a financial and a medical care plan for aging parents, visit my website, PamelaDWilson.com. Click on How I Help, and then my online support program. It's called Support Caring for Aging Parents. Module 5 has very specific information about how to create a care plan. So before the break, we were talking about the situation of care of children and elderly parents and the time frames, and talking about the skills being very similar but very different in the sense that if you have an aging parent who has health concerns, let's say diabetes or high blood pressure, you might find yourself managing a lot of medications. If you're caring for children, more than likely, they're probably pretty healthy and they're not taking medications, maybe vitamins at the most. So in addition to having a parent with diabetes, maybe you take their blood sugar, maybe you help with their continuous glucose monitor or their insulin pump. People who have diabetes have very detailed nutrition needs, so maybe you're helping mom or dad manage their diet. All these things may be skills that you as a caregiver must learn. Parents with high blood pressure may need to track their blood pressure readings every day, so maybe you find yourself using or you teach your parent to use an automatic blood pressure monitor and put the readings in a notebook, and this information goes to the doctor. On the other hand, there are other issues that can be embarrassing. Men and women can become incontinent. So, like with babies, but you're on the other end, you help with personal hygiene products. Or maybe your father has a catheter bag that needs to be emptied. There's all types of unexpected tasks that caregivers find themselves learning. This is where the care plan comes in. Creating a care plan to help manage medications, to reorder them, to put them in reminder box, to create a schedule to order these supplies. Having this type of project list or care plan can reduce a caregiver's daily stress. With all of these details to manage, it's important to have honest discussions with parents about what is possible and what is practical. Part of this includes what are they willing to continue to do from themselves from a staying healthy perspective. For all of us, remaining physically active is one of the best things to remain independent. If your parents want to continue to live in their home and they're starting to experience weakness of any kind, this may require effort to reduce those trends. Because when we're young and healthy, it is so easy to take good health for granted. But with age comes physical weakness, potential injuries, health problems. If your parent sees a doctor, what health recommendations has the doctor made? Are your parents following through? Now, on the lines of creating a care plan, part of the reasons that families don't plan is that it can be really hard to know what to watch for. So if you go to my website, PamelaDWilson.com, I want to mention this again, click on How I Help. There is an online course. It's called Support Caring for Aging Parents. There's 8 modules. Module 5 is the one that you want to look for because that offers very specific details about what I'm talking about on this show, about creating a medical and a financial plan to care for aging parents. That financial plan does begin with what money do elderly parents have to pay for not only their regular expenses, but unusual expenses and health care. If your parents don't have a budget, help them create one. Then look at the big picture. Day-to-day funds, unusual expenses that come up once a year, and then money to pay for care. And if there is money, based on the numbers I mentioned before for assisted living, for nursing homes, how long will that money last given those rates? If there's no money available for any extra care, I very, very strongly encourage you to investigate Medicaid as soon as possible. Now, Medicaid is different from Medicare. To find out about Medicaid, call your local county office on aging or the county health department. They can give you the information on how to contact Medicaid, which may be called by a different name in your state, because the states regulate the Medicaid programs. Then, when you get the information, go through the process of learning how or if your aging parents can qualify. And I know these discussions, they're not easy. Talking about money, especially when there isn't enough, is never anything that any of us want to talk about, right? But if you don't have these conversations, caregivers will pay a high price with their health and their income, especially if you are paying expenses for your aging parents. The other side of a care plan is the medical side. And then in the middle of all this, between the financial and the medical, is a legal plan for medical and financial power of attorney to allow people to make decisions if or when you can't. And I also recommend that caregivers should have these documents. Don't wait until you're your parents' age to initiate these. If you want more information on power of attorney, there's a lot of articles on my website, PamelaDWilson.com. Just go there. At the top right, there is a little oval where you can type in search terms. Type in medical power of attorney, type in financial power of attorney, and articles will come out. So let's talk about topic number 2 that I shared at the beginning of the program. These are the practical steps to complete so that you can't say, I don't have a care plan. I don't have a caregiving plan. I don't know what I'm doing. Well, these practical steps include research and becoming more educated about the health conditions of your parents and about options for care that do not mean that you are the caregiver. So where do you find these resources? Depending on where you live, your local area agency on aging or the state might have a website with a list of resources for caregivers. In some states, there are publications called the Seniors Blue Book. There's a lot of information in these books. And where we'll start here is we'll talk about disease-specific organizations, because these can really help you learn about a parent's health diagnosis if you don't feel that you're getting enough from the doctor. These are organizations like the Alzheimer's Association, Stroke Association, Parkinson's Association, Heart Association, Arthritis Association, and many others. If your parent has any of these diagnoses, there's likely a disease-specific organization, either on the ground, a building that you can drive to, or one online that offers free information. Some of these organizations might even have caregiver support groups. Another way to learn about your parents' health conditions and the medications they take is to attend a doctor's appointment, 1 or 2, with your parents, to learn about their conditions, the medications they take, and what the doctor is actually telling your parents. Then you can do a little bit more research if you're still curious. Now, if you want your parents to participate, I would involve them in these discussions. Go to the doctor, and when you leave, say, Mom or Dad, what do you think the doctor told you today? What do you think their recommendations were? Just to see if your parents are tracking. Because if you do everything for them and you don't involve them, what's going to happen is you're going to end up doing way more of the work, which then means that you will not have a life, which you may already be doing too much and not have a life. Again, this is all the more reason to create a caregiving plan. So understand each health diagnosis, how each diagnosis relates to the other, know what medications your parents are taking, find out why they're taking the medications. Become the expert on your parents' health conditions, and do the same for yourself if you have health issues. If you do and they're in the early stages, you may be able to prevent them and not even have to take medications. It's possible to prevent health conditions from getting worse. So if you go to a doctor and you're not satisfied with an answer that the doctor gives you, or maybe they make a recommendation and you try it and it doesn't work out, make sure that you go back to give the doctor feedback so that the doctor doesn't make a recommendation and then he thinks that you're going to follow through and you don't follow through. And then there's disappointment on the other end that, well, the doctor's trying to help, but the patients are not helping themselves. Finding a geriatric physician, if your parent still sees a primary care physician, can also be very helpful. Geriatricians have extra training in the care of older adult conditions. Now, there is a shortage, though, of geriatric doctors, so you may have to get on a wait list if this is an interest, but I do highly recommend it. When I was a care manager, I only took my clients who were elderly to geriatricians. The other risk for older adults and seeing doctors is that categorizing people or making any generalizations about somebody who is 70 years old or 80 years old might not really offer the best solutions for an aging parent or you if this is you going to the doctor. Now, there's always exceptions to the rule. But know this, doctors, as much as they want to do a good job, can only make their diagnosis or their recommendations based on the information that you give the doctor. They are not mind readers. They cannot see through your body. They cannot see what's going on. All the more reason to have a medical care plan where you have medical history in that document. And you take these pages with you when you go to the doctor appointment, and you take a notebook and you document everything that's discussed. Now, what I will tell you to help doctors help you is doctors like facts and timelines. So if your parent got sick, when did it happen? What time of day? Was it a one-time event? Is it repeating every day? Is it getting worse? Is it getting better? The more detailed information you can share and the more questions that you ask, the better care that your parents will get. So be curious, research, learn about health conditions so that you and this person, your parent, your spouse that you care for, can make really good decisions. Now, let's talk about just more cost research, right? Research in-home care agencies, assisted living communities, nursing homes. Call 2 or 3, ask for information, even go meet with them. Go visit a care community, take a tour. While this may seem like a lot of time and effort, I really do recommend you doing this before there's any type of need so that you have a plan in place when something happens and you don't have to make a rush decision. Crisis planning, for example, a parent goes into the emergency room, they're sent home, and all of a sudden they can't be left alone. They need 24/7 care. You work full-time. This can be very stressful if you don't have a plan for arranging services or if you haven't done prior research. You have to start from scratch. My recommendation, do the work up front. Make the time to work on a care plan so that if something happens, it's going to be a breeze for you to make decisions because you're going to have the information at your fingertips. Also, make that care plan if something happens and there is no money to pay for care. Know the Medicaid program in your state, what it offers, how to qualify, the steps to apply, what documentation is needed. Make sure that you have all of this at your fingertips. And let me just say this, the idea of creating a medical and a financial plan for your aging parents versus yourself really isn't any different. All of this work that you do will benefit yourself. Having these documents can help you move through situations that are going to advance with age. None of us is turning back the clock, right? We're all going in the direction of being older. And so the opportunity of creating these documents means that you can talk with the person that you care for to find out what they want for their care, to find out a lot of specific information. Now, if you've tried this multiple times, I recommend continuing to try, but there may be a point where your parents just dig their feet in and they say, you know what, I'm not getting older, I'm not dying, I'm not making a plan. It's true. Some loved ones can be in denial about the seriousness of their situation, or maybe it's a situation where, sorry, but you're the children and they don't trust you. So if you're the caregiver caught in this situation, recommend that your parents talk to a care navigator, an advocate like myself, to see where you can move the situation to. If they don't want to do that, then your best situation, so that you don't pay the price of being a caregiver, is to set some boundaries. So beyond all the skills we talked about earlier that caregivers never think they will need to learn, like helping with medical or personal care, number 3 is having to initiate discussions you never thought you'd have to have. If your parents refuse care and you are in over your head financially paying for their care, or maybe you're the caregiver who's got no more available time in your day, it's time to take a step back. Maybe you're feeling resentful that your parents won't cooperate. Maybe you're feeling guilty that you need to step back. But honestly, there may come to a point where that price of being a caregiver is too much. You're having difficulties at work, your marriage, or your relationships with your children. They're suffering. Maybe you're sick all the time. There is a point where enough is enough, and that saying, something has to give, comes into play. If your loved one refuses to cooperate, set boundaries. If you need an example of a discussion, it goes like this: mom or dad, husband or wife. I have spent hours doing research on your health conditions, medications, cost, and options for care. And you know this because I've gone to some doctor appointments with you. I've taken you to look at care communities. I want to now have a discussion and create a written and a financial and medical plan for your care so that there's no doubts about what you want if you become sick. And also because I can't continue to be your caregiver and do everything. Now, if your parent refuses, then you have to just step back. Acknowledge that there is a difference of opinion here. State your limit, something like, I was hoping that we could agree to do this together, but it seems like maybe we can't. While you think about this, I'm going to be cutting back on the time that I help you to get to something that's more reasonable for my schedule. Here's all the information. Give them all the information that you gathered. Here's all the information I researched. I suggest that you look at this information, reach out to the organizations, learn about the options, get your questions answered, so that if something happens and I can't be here for you, which I cannot guarantee anymore, you have a backup plan for care and you know what to do. Now, honestly, these discussions, they may not go well. If your parents are used to your help, they may be pretty angry. But that's their choice to be angry. It's their choice not to be proactive. Your choice is to stop paying with your life, your time, your health, your career. And just to acknowledge that everybody has the right to make not so good decisions and good decisions. And a lot of times it just depends on where we are in our life, right? If we're super busy and rushed, we may not have time to research caregiving options. So maybe a crisis does happen and you as the caregiver makes a decision that didn't turn out to be so good. Well, you know what? It was probably the only decision that you could have made at the time with the information that you had. So all of these things, there's no really right or wrong. There's just a lot of information and a lot of research that you can do. So let's talk about setting those boundaries with your parent to say, here's all the information. Call these companies because I may not be able to help you. You have to maintain that boundary by not rushing in to save the day when they call you for help or they have some other type of emergency. Remind your parents that you provided the information to help them make a plan and say, when you're ready to talk about that plan, I'm happy to meet with you. I'll type it up. We'll document it. But in the meantime, make sure that they call those resources, that they find out about care costs so that at least they know what their options are if something happens. That action helps your parent help him or herself, and it takes you out of that position of being the one who made the decision. or made the decision and something went wrong and now your parent wants to blame you. So if you're feeling stretched or overextended in your caregiving duties, remember, if you don't have a plan, you won't have a life. Many caregivers I know find themselves in this very difficult place. Some decide to make a change and commit less time to being a caregiver. Others stay in for the duration, and they experience a lot of health and emotional challenges. Know that there's no one wrong or right answer. There's only the choice that you decide to make. Thanks for being here with me on this week's episode of The Caring Generation. Please check out the other 170 plus episodes. Share this podcast with everybody that you know so that we can extend the support and the education and the love that so many caregivers and the people who receive care need. I'm Pamela D. Wilson, caregiving expert on The Caring Generation. I look forward to being with you again soon. God bless you all. Love to everybody. Sleep well tonight. Have a fabulous day tomorrow. And enjoy each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.